So welcome everybody who's here today. This is obviously a very important week for Keck Medicine of USC. We are scheduled this week to receive our very first shipment of COVID-19 vaccines. I know that many of you have questions, the community has questions. I would encourage if you do have any specific media requests, you can visit news.keckmedicine.org. That's the address for our newsroom. It has the contact information for everyone on our media team. We're happy to help. Also photos and videos that you might find helpful. Gabby posted the link in the chat, so feel free to bookmark that. But also to help answer your questions today, we have joining us Dr. Neha Nanda, Medical Director of Infection Prevention and Antimicrobial Stewardship with Keck Medicine of USC, as well as Krist Azizian, Chief Pharmacy Officer of Keck Medicine of USC. So thank you, Dr. Nanda and Krist, for being with us today. Krist, let's start with you. Can you talk a little bit about the process of securing the vaccines for our hospital?
Sure. Good afternoon, and thanks for having me today. So when we look at security, we are going to be storing and securing the vaccine within refrigerators and freezers in our secured pharmacy locations with 24-hour monitoring. Additionally, we will be having security on campus, particularly throughout the vaccination process, and we'll have security presence in the vaccine clinic as well. So plenty of security, and we'll be keeping all eyes on the vaccines. Furthermore, the vaccines will be essentially handled, managed, prepared for administration by trained pharmacists and pharmacy technicians. And so it will not be touching many hands until it actually makes it into the patient.
I know we've had a few questions about the logistics of storing the vaccines and our freezers. Can you talk a little bit about that too?
Sure. So the Pfizer vaccine specifically has requirements to be stored at ultra low temperatures, particularly minus 70 degrees. And to that end, there aren't too many healthcare organizations that have those readily available and on hand. So we did have to purchase 6 refrigerators specifically for this reasons, 3 for ultra low temp and 3 for essentially routine freezers to be able to also create capacity for both Pfizer and Moderna vaccines. And we've been coordinating with our facilities team for essentially securing those freezers, et cetera, and making sure they're on emergency power in the event that we did have a power outage in order to ensure the integrity of our vaccines.
Great. So between Keck Medical Center and USC Verdugo Hills Hospital, we're scheduled to receive this week about 2,500 vaccines. So can you tell us a little bit about how we schedule 2,500 vaccinations and the timeline for how we're going to get that completed?
Sure. So there is definitely a lot that goes into coordinating that. I think one of the main challenges we have this first go around is because we were not one of the hubs that would receive the vaccines directly on this initial shipment. We basically have a 5-day time limit from the time we receive the vaccine or pick up the vaccine from our hub, which is LA County, to the vaccine expiring. So we need to administer that many doses within a 5-day time frame. We are currently anticipating picking up the vaccine sometime on Thursday, and we are then anticipating to begin vaccination or starting our vaccine clinic within 3 to 4 hours after we pick up the vaccine. And at this rate, we are looking at somewhere around 400 to 500 individuals getting vaccinated a day to be able to go through that number.
Wow. So Dr. Nanda, a question for you. So the CDC has recommended a tiered system for vaccine distribution with frontline workers and first responders in that top tier. Can you tell us a little bit about the workers here that will be in that category and how we went about making those decisions?
Thank you, Mary, for having me over here. I think one thing I want to emphasize is uh, at a federal level, several scientific organizations have weighed in and created frameworks. And across the framework, the commonality has been that phase 1A is where healthcare workers and staff and residents of long-term care facilities will be prioritized. Now, within the healthcare workers, again, there's sub-prioritization that's required. And with that, for that also, there's guidance. There are frameworks from several scientific societies. And we have relied on ethical principles that have been laid down by Advisory Committee of Immunization Practices that has been endorsed by CDC, whereby distribution has to be equal. We have to ensure that we are truly reducing morbidity and mortality in a given individual. And I say that because of the evolving data around the vaccine as it's becoming available. With that, we have prioritized healthcare workers who are working in or caring for COVID patients and people who are at high risk, who are in high risk settings. For instance, if you're doing a procedure which puts you at a higher risk, you are prioritized. In addition, there are areas where we are testing patients, and it is an influenza season where you're getting a huge group of patients who need to be ruled out for COVID. So that's another group that we have prioritized. This is where we are going to start.
No, and are there any groups of people who won't be getting the vaccine or can't get the vaccine?
So if you followed the news the scientific news in the last 5 days, it has become more and more permissive as time has gone by. And where we stand today, there's only one group today where we have an absolute contraindication, and that's a group that has a severe allergy / anaphylaxis to any ingredient in this Pfizer vaccine. Then another group closely following this group is a group where you want to administer the vaccine with precautions. And that's the group that has experienced anaphylaxis or a very severe adverse effect after they received a vaccine or an injectable medication. Then there's a third group where, based on the large study that was published in New England Journal in the last week, where we don't have a lot of data based on that study, but the data is getting collected, that's groups like people who are pregnant, people who are breastfeeding, stem cell transplants, solid organ transplants, and people who are on immunosuppressants. And I think the overarching recommendation is that we want to be inclusive in this effort, because looking at the scientific study, really the risks are minimal, if at all. This is based on, I should add, 2 months safety data. So we have to keep an eye out. And I think the fact that it has received a EUA by the scientific society, by the scientific branch in FDA, under the auspices of FDA, that's very, very encouraging.
And what if anybody who may have contracted COVID recently, would they also be eligible to receive the vaccine?
They will get it at some point. However, given that at this time we are prioritizing, we are sub-prioritizing, it would be wise to make sure people who have similar risk are given priority over this group. And the reason I say that is, now I think there are multiple studies saying that for 90 days at least, you have durable immunity after you've contracted COVID infection. With that in mind, at our organization, what we are recommending is if you've had acute COVID infection in the last 90 days, you don't need to rush right now.
Okay. So how can people expect to feel immediately after receiving the first dose of the vaccine?
Mary, I lost your connection then. Can you
I'm sorry.
repeat the question?
I was, what can people expect to feel in the immediate aftermath of maybe getting their first dose?
So based on a study that was done in 44,000 people, the big study that came out, Pfizer, of those 20,000 approximately people got the vaccine and 20,000 were placebo, as in they didn't get the vaccine. In that group, what we've noted is that within the first day or two, about 50 to 60 people, I would say, feel fatigue, headache. You don't feel great. And in that group, 20 to 30% of the people actually had fever.
Okay.
Typically, the symptoms resolve within 2 days. Occasionally, it lasts longer. The side effects, Mary, what we have learned based on this experience and also experience coming out of UK with the same vaccine, is that these effects are higher with the second dose compared to the first dose.
Okay, good to know. So once we've vaccinated our healthcare workers, and not even just here, but kind of in the larger community, and we have this population of people who might have some immunity to COVID, how does that affect the day-to-day life of everyone else in the community? Does this change anything at all?
I think we have the vaccine, okay? And that's amazing, right? If you just think back, like just this morning at the health system we were talking, it took more than 10 years to get the polio vaccine. And there were people who got polio in their 40s and 50s, and we lost them, right? We lost a lot of people. And now within 9 months, we have a vaccine. It is going to change our life. However, as we get closer to changing our life, we have to give importance to all other tools that we have in our bucket. That's masking, physical distancing, testing, contact tracing. We have to respect all those. However, with time, when 70% of the population is vaccinated, getting a vaccine is very different from getting vaccinated. So when they are vaccinated, at that time, we will likely have some normalcy in our day-to-day life. Till then, let's just hardwire our masking, physical distancing. It almost seems like I'm preaching to the choir. Everybody knows.
So here's a question for both of you. What comes next? After we've gotten these vaccines, we've vaccinated all of our people, what's the next step?
Chris, do you want
to? Just a clarification of the question. Are we talking about vaccinating post-initial batch or vaccinating the entire population?
All the steps in between, I guess, in the coming weeks. Let's look at like the next 4 weeks or so.
Yeah, so I'll take the coming weeks because I don't know that I have a crystal ball for anything beyond that at this point. I think, our initial priority groups, as we've mentioned, are our healthcare workers. The way things look currently and based on the information we have, barring any production issues with the vaccine from either one of the manufacturers, I think we're looking pretty good to have our healthcare workforce vaccinated probably by mid to end of January. That would be my assumption, given everything goes as planned. And then further shipments would be available and further doses will be available to start vaccinating the public, basically. Based on everything we've seen and we've heard, it's very possible that we've vaccinated or we've gotten to that 70% that Dr. Nanda has mentioned, very well likely by end of May or June.
Wow.
That's the goal for us.
Great.
Chris, if I, just similar to what Chris is saying, the next phase is going to be essential workers and people with comorbid illnesses and people who are more than 65. So people who have not fallen into the category of healthcare workers, first-line responders, and if they're not working in long-term care facilities. So that group is going to be the next phase. After that, all the people who didn't fall in these phases, it's going to be that. The hope is that by April, May, or even sooner, anybody who needs to get a vaccine will get the vaccine. That's the hope. And like Chris said, if all goes as planned, that should be where we will be.
Well, that's very exciting news. So at this point, we are going to open it up for questions. So if any of the attendees would like to submit their questions using the bottom button at the bottom of your Zoom window, you're welcome to do that at this point. We are going to do our best to answer as many questions as possible. If for whatever reason we don't get to your question, we are going to do our best to follow up. So another note, if you do have any specific media requests for video or the transcript or recording of this webinar, feel free to reach out. Again, all of our contact information is on news.keckmedicine.org. And we will also be posting a link in our chat to B-roll. I would bookmark that link because we will be updating that with additional photos and video of deliveries, vaccinations in the next coming days as those become available. So I guess if we want to start with questions, that would be great.
So I'm not seeing any in the chat at this time. So if there are, like Mary said, if you have questions, feel free to post them. Oh, let's see. Okay, one question. How many people in your workforce at Keck Hospital of USC and Verdugo? So I'm thinking that's in totality, how many employees do we have at each of the two hospitals?
Chris, do you want to go?
Yeah, so we're about 8,000 to 9,000 healthcare workers amongst all three.
Okay, another question, which I think is very similar, we may have answered. How many people do you need to vaccinate just to cover the healthcare community? So I'm assuming, I don't know.
It would be the same answer.
Okay. Okay, one question. Why is there a 5-day limit from when you pick up the vaccine?
Sure, I'll take that one. So as we've stated, the Pfizer vaccine requires ultra low temperature storage. What is happening with this initial shipment is the shipment is going to specific hubs for Southern California, being LA County, Kaiser LA, Cedars, and UCLA. So while they receive the vaccine directly and can move it directly into a freezer, which would give it its lifespan of 6 months in the freezer, when we pick up the vaccine, there's no capability to pick that up in a ultra low temp transporter. So our best capability is to receive the vaccine at refrigerated temperatures, which immediately puts us into that 5-day shelf life. So the vaccine is only good for 5 days once it's at refrigerator temp. Future shipments will be sent to us directly, and we will be able to order to our allocation. And at that point, we can store it immediately into ultra low temp freezers, which will then put us up in par with the hubs.
Great.
A follow-up question to that was, can't you just refresh the dry ice?
Yeah. Great question. The containers in which Pfizer ships vaccine, currently the hubs are not releasing those containers and are sending it back to Pfizer because Pfizer would like them back before they ship additional doses to the hubs or to anybody. And therefore, it's not an option for us as pickup.
Okay. Another question is, how soon do you need to administer the second dose of the vaccine after the first is received?
So it's
Go ahead.
It's for Pfizer, it's 21 days. And now we know that you have some leeway of 4 days before or after. The other vaccine, Moderna, that's going to undergo review on Thursday by FDA. There, the time period is 28 days as we know it today.
Very good. Another question. Is there any reason a person would not receive the second dose of the vaccine if they have received the first?
So we should, for us to be considered immunized, for vaccination to be complete, I'll rephrase it, for vaccination to be complete in an individual, to consider that person vaccinated, at this time, we need 2 doses. The way the study was conducted, we cannot endorse or support simply giving 1 dose. And if you really want to get into the nitty-gritty of it, if you want to look at the study, people who got the vaccine only single dose, the range of the number of people who actually had the same level of immunity varied anywhere from 30 to 60. But all the same, you cannot draw conclusions. We can't draw conclusions based on that because the study was not designed to assess the efficacy of a single dose vaccine. Long story short, we need to give two shots 21 days apart.
Yeah, I would just, if I can add, I would just say if an individual was not aware that they had hypersensitivity to one of the ingredients and unfortunately find out after receiving the vaccine that they have severe reactions to one of the ingredients of the vaccine, that would be an exclusion criteria for them from the second dose.
Okay, that makes sense. Thank you. One other question. How are patients tracked to ensure there isn't cross-vaccination of like the Pfizer and Moderna from dose 1 to dose 2? And what happens if there is a cross-vaccination?
Chris, I can just say that what is recommended and what our policy is going to be. So based on everything we know today, a person who gets Pfizer on day 1 is going to get Pfizer on day 21. Someone who gets Moderna on day 1 is going to get Moderna on day 28. We are not going to replace one vaccine with the other. And there is a process that we are working on, and I think Chris can perhaps speak to that better.
Yeah, so obviously the doses will be documented and clinical outcomes will be documented in our medical record. And we will be essentially scheduling the second appointment with the name of the vaccine for the individuals to come, whether it's 21 days or 28 days. And we will be running basically routine reports daily, depending on whether or not we end up having vaccine clinics every single day for the next few months. On whatever frequency, we'll be running our reports to ensure that we are allocating the appropriate vaccine for administration to employee health. Additionally, again, our pharmacy team will be managing the dispensation of the vaccine as well as the preparation of the vaccine. And we'll have full access to the patient's chart and record prior to administering the vaccine. So there'll be double, triple, quadruple checks prior to the second dose for someone receiving the second dose.
So it looks like we don't have any open questions at this time. If there's anything we didn't get to, anybody in attendance would like to reach out, again, news.keckmedicine.org. Dr. Nanda, Krist, thank you so much. Best of luck this week. And yes, this has been great. So thank you, everyone. Okay.
Thank you.
Thank you.
Bye.